Thank you, Senator Heinrich. We're going to hear from Senator Menendez, Senator Klobuchar, Senator Manchin, Senator Murphy, Senator Blumenthal, and Senator Hassan. I've also invited here to speak today Michael Botticelli from the Grayken Center in Massachusetts. He just left the job in the Obama administration of running the program to deal with all of these issues, as well as Dr. John Aldis and Shelby from the state of West Virginia, Senator Manchin's constituents. We all know that the opioid epidemic is an equal opportunity destroyer. It has ruined lives of men and women from Lexington, Massachusetts to Lexington, Kentucky. And I thank our guests from these states for being here with us today. I will start my remarks with a simple statement. This Senate Republican health care bill would be a death sentence for those patients suffering from opioid addiction. All the bipartisan progress we have made on combating this crisis will be thrown out the window if Senate Republicans repeal and replace the Affordable Care Act with their cruel and inhumane and immoral legislation. The legislation the Senate Republicans have introduced, we now know will rip coverage away from 22 million Americans. It will eviscerate Medicaid to the tune of $772 billion. And by ending Medicaid as we know it and gutting consumer protections in the private health insurance market, Trumpcare will shift billions of dollars in cost for substance use services onto the states and the families that suffer from this disease. For individuals suffering from substance use disorders, repealing the Affordable Care Act isn't about repealing a health care law, it's about repealing hope that all of these families have, that they will gain access to the treatment which they need for this disease. Medicaid is the largest payer of substance use disorders in the country. It covers about 1/3 of Americans with an opioid use disorder and pays for nearly half of the medication-assisted treatment in Massachusetts. Those of us from states hardest hit by the plague of opioid use disorders hear time and time again how Medicaid coverage of these services saves lives. To make up for these draconian cuts to Medicaid, the Senate Republican healthcare legislation creates an opioid fund of $2 billion for 2018. Now, compare that to the $91 billion in funding for opioid use disorder treatment that would be provided by the Affordable Care Act over the next 10 years. That's $2 billion opioid fund as chump change for a crisis that took 2,000 lives just last year in Massachusetts, 33,000 lives across the country. And if people were dying at the same rate as they are dying in Massachusetts, 100,000 people would have died last year. The answer is prevention. The answer is treatment. Those programs will be slashed by the Republican health care bill. Medicaid is a lifeline away from patients suffering from the illnesses of addiction, and this bill flatlines the Medicaid program. And if this bill becomes law, there is no reviving Medicaid. Once it's cut by this legislation, it is dead. It's unfortunate that Republicans who have touted our progress on opioid issues aren't standing up to the policies in Trumpcare that would negate their hard work, but by supporting this, they are betraying the families and communities which have suffered from the relentless grip of substance use disorders. The passage of this bill will make GOP stands for gutting overdose protections. We know a vote for Trumpcare is a vote to perpetuate overdose deaths. Passing this bill will just be aiding and abetting one of public health's most wanted and most notorious serial killers. In fact, it will take the money that is cut for opioid treatment and protections and then package all the money that's saved as tax breaks that will go to the wealthiest people in our country, including the pharmaceutical company executives who profited over the creation of this problem back in the 1990s and into the beginning of this century. So let me now turn and recognize Senator, the great senator from the state of New Jersey, Bob Menendez.
Thank you.